Let's begin with the next part of parasitology. There are going to be a set of 3 families that we have to talk about, and these include the cystodes, the trematodes, and the nematodes. Amongst the cystodes, first I'll tell you their names. Cystodes are also referred to as the tapeworms because they look like tapes, flat like tapes. Then the trematodes are said to be flukes because they look like a leaf. And the nematodes are said to be worms like roundworm, hookworm, and all of those. Please remember, out of these, the only one having a body cavity is the nematode. And if there is a body cavity, of course, there is also going to be an alimentary canal in it. The only one with a body cavity and alimentary canal. The others don't have a body cavity, don't have an alimentary canal. Also, which is the only one which is dioecious. Dioecious means that it is going to have male and female separate, is of course going to be the nematodes only, whereas the other ones are going to be hermaphrodites. Of course, there are some exceptions which I will tell you eventually, but broadly all of them are hermaphrodites. Only nematodes are male-female separate. So remember, everything is with the nematode. The body cavity, the alimentary canal, and the male-female separation. But who has the segmentation? Please note, the cystodes are the only ones which are going to be segmented. Rest all of them are non-segmented. So is your basic table okay with everyone, so that I can now move on to other definitions? Before I start with parasitology, I first want to give you all some definitions. For example, whom do you define as a definitive host? A definitive host is the one in whom the sexual reproduction happens. The male, female, gametocyte, or wherever the larva, the sexual reproduction happens, eggs are laid, that is going to be the definitive host. Whereas where all the asexual reproduction is going to happen, that is going to be the intermediate host. So let me tell you that in most of the cases in human beings, in most of the cases we are the definitive host, but there will be a list where I will tell you that man is an intermediate host, means in us only asexual reproduction will occur. So what is that? When we are an intermediate host, it is known as best top. That is a mnemonic that we have. What is best top? So B is going to be for Babesia. E is going to be the dog tapeworm, Echinococcus, because dog tapeworm hai, so we are not going to be the main people. We are going to be the intermediate one. Dog will be the definitive host. So B we have for Babesia, E we have for Echinococcus. S is going to stand for Sarcocystis, which we don't read too much, but you just have to know. Then we have T, and P. So TTP stands for, T stands for the very, very famous, the Toxoplasma. T for Taenia solium and Plasmodium. So repeating, Babesia, Echinococcus, Sarcocystis, Taenia solium. Ye best ho gaya. And top is going to be Toxo, TO for Toxoplasma and P for Plasmodium. So I think this is sorted, but right now it's more of ratta because you've not read all of these. When you read all of these, you will realize you don't need this mnemonic. I'll give you adequate life cycle mnemonics over there that you won't need all this story, right? Let's move forward. So definitive host is where sexual reproduction occurs. Intermediate is where asexual reproduction occurs. So now we move on to the next one, and what is a paratenic host? A para always means someone on the side. So paratenic host is the one in whom the larval stage is going to survive. Right now, they're just definitions, just register little bit parts of it. So larval stage is going to survive. That is a paratenic host, means it is just going to survive, only survival, but there is no further development. There is no development that is going to occur. There is only transmission. That larva will only be given forward. That larva is not going to become advanced or developed. So remember, paratenic host is just one host on the side who is storing the larva and is going to give it further. No development is going to occur in it. Finally, who is the accidental or the dead end host? I don't need a definition for this because accidental word tells me that it is going to be by an accident. Like for example, let me tell you that in Echinococcus granulosus, humans are the accidental host. Humans are the accidental or the dead end host. Actually, we can be intermediate also, but we are actually the accidental or the dead end hosts that by chance it comes into us. So that is something which is very important. I hope everyone's okay with these definitions because we are now moving forward to host ho gaya. Definitive, intermediate, paratenic, accidental. Now we come to vectors. Vectors are the things which are transferring it. So what is it? Pehle dekho, I can see a lot of words written. Propagative vector, cyclopropagative, cyclodevelopmental. I want you to learn something. Propagative vector is the vector. What is the next alphabet in whom replication will occur. So if replication of the organism is occurring in that flea or that louse or that tick, that is a propagative vector. Whereas if we are talking, so everywhere propagative word comes, matlab ma'am replication is happening. Wherever cyclo word comes, so remember cyclo ke saath D yaad rakhna, CD come together na, CD come together. So over there development is also going to occur. So let me repeat guys, when I'm saying first wala dekho, when I'm saying propagative, what is going to occur? Replication or development? Of course, only replication will occur. Propagative mein only replication will occur. There is no development going to occur, and that is what happens when we are talking about Yersinia. Yersinia is plague, na? Plague spreads by rats. You know that. So Yersinia mein all these rat and rat flea, they are actually rat flea wala jo vector hai, that is actually going to be a propagative vector. It is only going to result in replication, not in development. Next we come to cyclopropagative. Matlab, you will say ma'am propagative word is there, this means replication is occurring. Cyclo word is there, this means development is also occurring. This is a combination. For example, all the blood organisms, plasmodium, matlab malaria and babesia. In malaria and babesia, who is the vector? You know na, especially in, tell me for malaria, this you already know, female Anopheles mosquito. So over there is replication also, there is development also, that is cyclo also and propagative also. Finally coming to the last, that is cyclo-developmental. So over here C, D is anyway come together. So over here only the development is going to occur. Only the development will occur, there will not be any replication. Examples are going to be many things related to filaria, and also we have the flagellase, that is Leishmania trypanosoma. So right now as I said they are names, but thoda samajh aa raha hai, that is good enough. So repeating, propagative means replication, PR, replication will occur. Cyclopropagative means propagative matlab replication will occur. Cyclo means development will also occur. And cyclo-development means just development will occur. Easy to learn. Now before I proceed on to the main part, you need to know that whenever I will talk about any of these organisms, I will definitely talk about the stool samples. Now under these stool samples, please note that first thing is that you will do a microscopy. What will you do in microscopy? The first thing that you will be doing will be the very simple saline mount. You will look at the stool sample under a, mix it with normal saline. Another thing that you will be doing will be an iodine mount. An iodine mount mein kya hota hai? The thing is that the trophozoites, if at all the trophozoites have to be mobile, the trophozoites are immobilized. The trophozoites are immobilized, so that is why you will see all the motility and the moving around in saline mount. As soon as you put iodine, it is going to be immobilized. So remember, iodine mein, it is going to be immobilized. Moving on, coming to, if you say that ma'am, I have a stool sample or whichever sample I have, but the parasite is not too much, the oocysts or the whatever parasites, trophozoid cyst, whatever you're trying to see ma'am, that is not too much. So what does that mean? That basically means that we are dealing, or we will have to do some concentration techniques. When I say concentration techniques, either, what are the two ways? If my parasites are very less in number, what can I do? Either I can make that sample sediment, then it will become very concentrated. Or I can make the eggs float, either make them float or make them sediment. So what are the two techniques that we have? We have number one, the very famous flotation technique and sedimentation technique. So if I use saturated salt, some things will start floating. So saturated salt flotation technique hota hai. Whereas formal or formalin, if I use formal or formalin, that is going to be the formal ether sedimentation technique. I hope everyone's okay with this, because these were to do with your remaining general parasitology parts. Now I think we are ready to take on our journey towards the three types, and those are going to be the cystodes, the trematodes and the nematodes. So let's begin with what? The tapeworm, which are segmented. Those are the cystodes. So let's begin with the cystodes chapter. And as I've told you that cystodes are the ones which are going to be segmented. And if you zoom in, you can definitely see that yes, there are segments present and they're looking like a tape. So these are all the tapeworms. Now the entire organism and everyone is going to look like a tape, everyone is going to look segmented. So how shall I differentiate? I'm going to focus on the head end. I can see their names: Taenia solium, Sarginata, H. nana, H. diminuta, Diphyllobothrium latum and Echinococcus granulosus. If I look at their head end, in all of them I can see there are some round structures, right? All of them have round structures, and these are known as suckers. So all of them, for attachment, they have got 4 suckers. Which organism does not show you a sucker? So over here, if I write this again, this is one of the most important organisms that you have. Look at how I've written it. Diphyllobothrium latum. It is Diphyllobothrium latum, which basically means that it's going to look like phylum. It's going to look like a leaf. Yes, it is looking like a leaf. And secondly, it is di, means it's not going to have any suckers, round suckers. It's going to have two something else. It's going to have two grooves. You can see that one groove is in front, one must be at behind. So one groove is like this and one is at the back. So these are going to be two grooves which are available for attachment. There are no suckers which I see over here. I hope this is question 1. You've understood which is the only organism which will look like a leaf and will show you the presence of these different lines or these grooves. That's Diphyllobothrium latum. Okay, rest all of them have suckers. How do I differentiate between the rest? Now I'm going to look at their hooklets. So first and foremost, which are the ones which have hooklets and which don't? So I'm going to tell you that all the ones that have ta in their names, they are going to do tata bye-bye to the hooklets. Okay, they are not going to have any hooklets that are there. So wherever you see tata, you're going to do tata to the hooklets, no hooklets. So when I say Taenia solium, hooklets are there. Definitely there are 2 rows of hooklets. But when I say Taenia saginata, do tata to the hooklets. There are no hooklets seen. Then when I do H nana, there are hooklets. Of course there's hooklets. But when I do H diminuta, again I say tata to the hooklets, so there are no hooklets. Again, Diphyllobothrium latum. This anyway did not have any suckers and hooklets, and anyway this is also lata. Diphyllobothrium lata, so tata to the hooklets. This also does not have any hooklets. Echinococcus granulosus has hooklets. So simple. Solium has saginata, tata, nahi hai hooklets. H nana has H diminuta, nahi hai hooklets. Diphyllobothria lata, tata, nahi hai hooklets. Echinococcus granulosus has hooklets. So simple. Wherever you see tata, do tata to the hooklets. So saginata, diminuta and lata, they don't have hooklets. Easy to learn, I hope now. Now, one last thing. All of them have how many rows of hooklets? The ones who have, jinke paas tata nahi hai, the ones who have hooklets, 2 rows, 2 rows. Which is the only one which has a single row of hooklet, and that is H nana. So remember, there is going to be a single row of hooklets that is present. So I'm going to repeat all of this once again. If you feel that you are feeling a little lost, we are going to do a quick recap. Firstly, which are the ones which does not have any suckers only? Diphyllobothrium latum doesn't have any suckers. If it doesn't have any suckers, of course, it doesn't have any hooklets. What does it have? It has 2 grooves for attachment. Okay, next, which is the one that looks like a leaf? Diphylum looks like a leaf, of course. Now we are going to say, what are all of the others having? 4 suckers, 4 suckers. All of them have 4 suckers, and all of them obviously have hooklets also. Which are the ones which don't have hooklets? So saginata, no hooklets. Diminuta, no hooklets. And lata, no hooklets. Rest all of them are gonna definitely have hooklets. And guys, which of them has only a single row of hooklets? And that is going to be H nana, and that is what I want to tell you. Now I'm going to give you a life lesson. This H nana is very interesting. That life lesson will come in 5 minutes. Before that, how are we dividing it? Please note all these. Taenia saginata and solium. So Taenia, and H nana and D latum. They are the ones which are going to go into the intestine. Rest all of them are going to go to different other organs of my body. But remember, Taenia, saginata, solium. H nana, because that is the smallest. It's the smallest tapeworm that we have, whereas Diphyllobothrium latum, the name is only so long that it is going to have the longest tapeworm that we have. So simple, if they ask you a simple question, smallest is going to be H nana, and latum, Diphyllobothrium latum, that is going to be the longest tapeworm. So smallest ho gaya, longest ho gaya, Taenia. These are going to be in the intestine. Rest all of them are going to be other parts of our body. So now you would obviously want to know their hosts also. So for all the cases, man is going to be the definitive host. Definitive host in all of them is going to be the man. However, in one of them, that is Echinococcus. In Echinococcus, man is not the definitive host. Dog is the definitive host. That is the reason that we call it a dog tapeworm. We call it dog tapeworm because dog is the definitive host. Rest everywhere, man. Okay, all of them are going to require 2 hosts. However, H nana has only a single host, and that is human beings. And Diphyllobothrium latum has 3 hosts. Diphyllobothrium. So what did I realize? Now I'm going to tell you that story. H nana, what was its size? Sabse chota. It was the smallest tapeworm that we had. Sabse small size. How many rows of hooklets does it have? The least. It has the Single, just one row of hooklets. How many hosts does it have? The least, just one host. So I can now make a table about H Nana and give you the life lesson that I wanted to. H Nana, God has given everything nano. Everything nano has been given to H Nana. In terms of the size, it's the smallest. In terms of the host, it has got only one host. In terms of the hooklets, it has again got only a single row of hooklets. So imagine, look at his resources, small size, single row of hooklets, single host, सब कुछ कम है. But you know, with those single hooklets, it has made the most of it and become celebrity. It is the most common cystode infection that we are gonna have, and that is what I want all of you to be. The life lesson is that you have to be H Nana. You don't have to run after hundreds of resources. You have to work in limited resources, limited sources, and make the most of it and emerge as a winner. So your take-home message is that in life, learn to be H Nana. Very, very less things in life it has, but it's become a winner. Okay, coming to the next, Diphyllobothrium latum. It's such a long name. In terms of the length also, we said it is the longest one that we have. And now in terms of hosts also, we are saying it's got the maximum hosts. So I hope everyone's okay with this basic introduction, because I'm going to now teach you the eggs, and after that we go into every organism individually. So what is this egg? This is an egg which has a lid on top of it. Whenever you see an egg with a lid on top of it, that egg is known as an operculated egg. Okay, so that is known as an operculated egg, and you can see there is a lid on top. And where all do you see it? So I'll give you a mnemonic for all parasitology. I'll give you one mnemonic over here. Operculated eggs are seen in STDs. What are STDs? Dekho how I learned it. Mnemonic also you should learn, na? Lid. When do you need a lid? When you need some protection. And where do you need protection? You need protection against STDs. So please learn Spirometra. Spirometra, which is also a cystode, shows you operculated eggs. D. latum. D. latum is also going to show you operculated eggs. And the next chapter that we are going to study, that is the trematodes. All the trematodes are going to show you operculated eggs, but tiny little exception yaad kar lo abhi ke liye, and that is schistosoma. All trematodes except schistosoma. So what is STD? S for Spirometra, D for D. latum, all from this family, cystodes, and T is for the next family, that is trematodes. So protection against STD, protection with the lid, that is an operculated egg. What is this egg? And I've got you a lot of labelings over here. So let's start with all these labelings one by one. Dekho, this is an egg. If I zoom into it, I will count the hooklets. 1, 2, 3, 4, 5, 6. Very faintly you can see, but yeah, this is known as a hexacanth embryo because it has 6 hooklets in the egg. This is a hexacanth embryo. Is that okay? So you've understood the reason for it. And in the exam, please don't get confused. What am I teaching you over here is the egg. These are the hooklets of the egg. What I taught you earlier was the hooklet of the full worm, the head end of the worm, wo adult worm tha. Now what I'm teaching you is the hooklet that you have in the egg. So how many hooklets? All of them will have, all the cystodes will have. So how I have learnt it is, cis stands for 6, hai na? So cystodes have 6 hooklets wala egg, hexacanth egg. Then let me look at the other labelings. I can see there is one outer membrane over here. Yes, if there's an outer membrane, there has to be an inner membrane, obviously. And in between the two, can you see some dirty dot kind of granules? These are referred to as the yolk granules. The dirty material is referred to as yolk granules. What else can you see if you zoom in? You will be able to see one knob over here and one knob over here. Yes, they are polar knobs. They have polar thickenings, and from those polar thickenings, some threads come out, polar filaments come out. So I will realize that this area, this gap is very, very busy. Between the outer and the inner membrane, firstly, you have some dirty material called yolk granules. Then you have some knobs. Then you have filaments coming out of it. Very, very busy area this has. And inside you have how many hooklets? Cystodes mein you have 6 hooklets. Everyone's done the basics. Now shall we start off one by one with the organisms? The first one, look at the name, Diphyllobothrium latum, the lengthiest name. What all do you know about it till now? It is going to be the longest. How many hosts it's going to have? The maximum. It's going to have 3 hosts. Does it have? See, diphylum. What I told you was it's going to look like a leaf. Does it have any suckers? No. Everything you know now. There are no suckers. Does it have any hooklets? Nahi. Diphyllobothria lata, tata to the hooklets. It's not going to have any hooklets also. What does it have? Why do you call it di? So finally, it has two grooves or bothria for attachment. Bothria means mouth. It has two grooves for attachment. So सब कुछ पता है ना? By now life becomes easy. And how many hosts did you tell me? You said it has 3 hosts. So why don't you tell me the host? So from today onwards, guys, instead of calling it Diphyllobothrium latum, please call it Diphyshobothrium latum, because now after that you will know that Diphyshobothrium latum has two fish. देखो human तो you will have to keep us man. Along with that fish you will have to keep two fish. तो कितना? Human and 2 fish. How many hosts? 3 hosts. So who's the definitive host? Of course that's gonna be us. And what is the first and the second intermediate host? 1 fish, second fish. So there's gonna be a main wala fish. And then there's going to be a chota wala fish. Chota wala fish is cyclops. So remember, if they give you human being with chota wala fish, that is cyclops, with big wala fish, that is fish. So if there's human fish, you know, oh, 2 fish, that is Diphyshobothrium latum. So because it has 3 hosts, it is also going to have 3 larvae. It is also going to have 3 larvae, and if you want to learn their names, L1, L2, L3 is safe side. But if you want to learn their names, you are going to basically number 1, call it alphabetically, chalo, CPP. So this is going to be number 1, Coracidium. Then procercoid, that is also can be skipped, but this L3 you have to learn. Plerocercoid larva. What is it about plerocercoid larva? Because that is the infective form. So simple. It has how many hosts? It has 3 hosts. How many larvae does it have? It has 3 larvae. And if I put L in front of it, L3, plerocercoid larva. Please learn this name. That is the infective form. So now if I show you the life cycle, you will not at all have a problem. You guys are very scared of life cycles, I know, but don't be. Pick up the host. Okay, I see a human being over here. Then I see there is a chota wala fish, and along with the chota wala fish, now there is a big fish. See, can you see that? There's a human being, a chota wala fish, and a big wala fish. If there's a human and 2 fish, it is Diphyllobothrium latum. Still, let us start going into the same. You can now start off with the beginning part. That what did we eat? So first you said that, ma'am, there comes a human being. This chota wala fish must have been cyclops, and this big wala fish that you're referring to must be fish. So basically what I'm eating is I'm eating fish. I'm eating some fish. Many fish lovers over here. I'm not here to scare you, but this is the kind of undercooked or raw fish that they are having. And which larva does it contain? Which is the form that is coming to us? It is the L3 or the plerocercoid larva. L3 or the plerocercoid larva that is going to come to us. Once it comes to us, we all know that what is this organism. You can see that leaf wala, so definitely it is Diphyllobothrium latum. But which part of the intestine is it going to? What is written? In the small intestine. Do I have to learn that, ma'am? Small intestine, yes. Remember, D latum tends to go not only in the small intestine, but it goes and attaches to the terminal ileum. Socho. What gets absorbed from the terminal ileum? Vitamin B12. But if Diphyllobothrium goes and attacks the terminal ileum, the B12 absorption is not gonna occur, and the patient is gonna suffer from megaloblastic anemia. Right? So repeating, this is a very famous path medicine micro integrated question. D latum goes and attacks the terminal ileum. Thus the patient has B12 deficiency. Okay, after that, what is it going to do? After that, of course, it's going to lay down eggs. Eggs will come out into the feces. You can see the egg has basically come out into the environment. Larva kaun sa banega? L1 larva, L2 larva, L3 larva. I already know 3 larvas are there. So when the egg came out, kya bana? The first larva. Do you remember the name of the first larva? Coracidia. Coracidia. Who engulfed the first larva? Who has eaten up the first larva? That chota wala fish eats it up. Cyclops. Cyclops has eaten it up. And Cyclops mein L1 changes to what? Cyclops mein L1 changes to L2. Fine, the chota wala fish will be eaten by whom? Chota wala fish is going to be eaten up by the big wala fish. And over there, the larva will change into what? It will change into L3. And then that L3 larva, who is going to eat the bada wala fish? I will eat the fish. So every time someone eats someone, one larva form changes. We passed eggs, it made L1. But when Cyclops ate it, it became L2. When bada wala fish ate it, it became L3. When L3 came into us, it became an adult. So simple, L1, L2, L3 and Diphyshobothrium latum. I'm going to call it Diphyshobothrium latum only. What are the clinical features? Like I told you, it's an intestinal infection. Terminal ileum mein ja raha hai. So of course, there's going to be abdominal pain with nausea. And I've told you an anemia. Bothriocephalus anemia. Oh my god, what a big name. Bothrio, because of Diphyllobothrium latum. But don't I know it is a kind of a B12 deficiency anemia, megaloblastic anemia. So now, please note, there is one parasite associated with iron deficiency anemia, and there is one parasite associated with megaloblastic anemia. So with iron deficiency anemia, what I'll be teaching you right in the end in the nematodes is going to be the hookworm. And right now, D latum I have taught you. Lamba sa naam, Diphyllobothrium for big megaloblastic anemia. Diphyllobothrium for megaloblastic anemia. Okay. Now tell me, how does the egg look like? You will say, ma'am, ab bar nahi karenge. We have done it once. All the eggs are going to have that lid. So sometimes the lid will be open, sometimes lid will be closed. Confused nahi hona. Over here, the lid is closed. So don't feel that, Arey, ma'am, I could not see the lid. The lid, you will see an imaginary line in the center. So yes, there is definitely going to be a lid. Wo bhi nahi dikha. By chance, you say, ma'am, in the exam, I could not zoom in. Lid nahi dikha. Look at the other end. It will have a knob. So all of these operculated eggs will have a lid, and on the other end, they're going to have a knob, and that is how you're going to identify. Remember, what was the mnemonic for operculated eggs? Operculated eggs are STD, Spirometra, Trematodes, Diphyllobothrium latum. So the egg is in front of you. How are you going to treat this? Of course, the treatment of almost all is going to be praziquantel. Let's move forward. Diphyllobothrium done. Moving on to the next, Taenia saginata solium. Firstly, can you see both of them? This also has 4 suckers and this also has 4 suckers. All of them have 4 suckers. But out of Taenia saginata and solium, who will not have hooklets? So you will say saginata, mein ma'am, tata to the hooklets. There are not gonna be any hooklets that you are gonna see. There are no hooklets. I don't see anything on the top. Whereas in Taenia solium, can you see? In Taenia solium, how many rows of hooklets are there? 2 rows of hooklets are there. Now the stories become easy, na? So tata mein tata kar dena. There are no hooklets. Now, abhi the story is very simple. Now what I'm going to show you, you would want to run away and you will say, ma'am, we want to disown your lectures now. Because this is one of the most troublesome table which every second year student, every NEET PG, FMG aspirant comes to me with, that ma'am, what has happened in this table? Trust me, you don't have to learn it the way you are looking at it. Try to look at the way I will look at this table, and I promise this is going to be the easiest table. Ab isme kya karna? Look at the lengthy name. Taenia saginata. Saginata is lengthier, na? Solium is chota na. So anything numerical I ask you, how much number, everything in number will be more in the Taenia saginata. So if they ask you that in the worms, that's why I did not split it into multiple table, because you don't have to read it only like this. Chota chota padna hai. Please remember, they ask you who is lengthier. You can see 5 to 10 meters is saginata, solium is chota. So who is lengthier? Saginata is going to be lengthier. Okay, look at the head end. Who has a larger head? Saginata has a larger head. Who has a pigmented head? Saginata has a pigmented head. Who has a longer neck? Saginata has a longer egg. Who has more proglottids? 1000 to 2000, more in number? Saginata. Who is going to have a larger gravid segment? Saginata. Who is going to have more uterine branches? 15 to 30? Saginata. Who has a vagina? Again, Saginata. Who is going to have more follicles in the testes? Saginata. Is this a tough table? Because you don't have to learn the numbers. You just have to make sure that you know that everything in excess that is happening, be it the length or the size of the scolex, the neck ka size, proglottids ka, uterine branches, vagina ka size, presence or testicular follicles, everything is more in saginata. But you will say that, ma'am, if I have an MCQ and they say that pick up the most important, so proglottids and uterine branches, number nahi yaad karna. Just know that to differentiate between Taenia saginata versus Taenia solium, we always prefer to take up this number 1 proglottid wala story and this number 2 uterine branches wala story. This is something, but yeah, you know what is more. Saginata is always going to be more, right? Okay, this was about Okay, Saginata mein everything is going to be more. Only one thing you have done Tata 2, and that Tata 2 that you have done is going to be that there are no hooklets. Tata 2 the hooklets kara tha, baki everything is going to be more. Now let's come to the real deal. This was the bad table. Now let's come down to host. Host to pata hai, ma'am, we already know. The definitive host of everything is going to be humans, but the intermediate host is different, na? Taenia saginata, it has ta, so cata, cattle. cattle is gonna be for Saginata and pigs are gonna be for Solium. ठीक है, cattle, Saginata and pigs are gonna be Solium. Okay, so I've understood. Now you'll say that every organism has two things. It has a larva and it has an egg. So what is the name of their larva? So देखो, cattle and all this, cattle, cows, this reminds me of bovine. Cattle, cows, bovine होता है ना? So remember Cysticercus bovis, you will say, okay ma'am, bovis मतलब bovine. This is present in the cow. This is present in the cattle. This is present in the cow. This is not in me. इसके नाम में ही है. This is present in the cattle only. Whereas Cysticercus cellulose, it has so many S's वाला sound. Cysticercus cellulose, सब में this larva is present. It's going to be present in the pigs also. It's going to be present in the humans also. That's just ways of learning that I'm telling you. Otherwise, your mind goes into such a frenzy and you can never learn anything. So remember, Cysticercus bovis will always remind you of cattle. ये only cattle में है. Only in cattle, not in man. Taenia solium, सब में. Solium, सब में. Cysticercus cellulose, सब में. Pigs में भी, man may be. Okay, so now you will ask me that what is the disease that they will cause. So remember the larva over here in humans. I want to know what it causes in us. It only causes intestinal infection. It is only going to cause intestinal infection. But Taenia solium, सब कुछ, everything is सब कुछ. So not only will it cause an intestinal infection, but it will also cause cysticercosis. Guys, I'm sure you've heard of neurocysticercosis. So basically other organ involvements are also occurring. Why ma'am? ऐसा क्यों है? Both of them are taenias. Both of them are causing intestinal infection. Why is this solium causing सब कुछ? Because solium का egg is also infective to us. The eggs that we will produce from these larvae and adults, these eggs are also infective to us. Whereas for Saginata, the eggs are not infective to us. So when the eggs are not infective, you will not have other organ involvements. When the eggs are going to be infective to us, that is when the organ involvement is going to occur. So please remember, for the other organs to be involved, why did I write organ with a big anda over there? For the other organs to be involved, I need an anda. That is, I need an egg. And the egg being infective to man, सब कुछ infective तो सिर्फ solium का हो सकता है. Everything. Now I'll tell you the सब कुछ story. This is going to have Cysticercus cellulose. That is the larva which is present in some people. It is present in pig also. It is present in man also. It is going to cause intestinal disease also. It is going to cause cysticercosis in the organs also. Iska larva is also going to be infective to us. Iska egg is also going to be infective to us. सब कुछ yes करना when it comes to the disease of Taenia solium. So God balances na. When everything in numerical numbers was given more to Saginata, everything in disease etiology is given to solium. God has a way of balancing things out. So now it's time for a test. You can see 1, 2, 3, 4. Definitely this is a cystode because I can see 4 suckers on the head end. And now if I say, is this Taenia saginata or solium? Of course you will say, ma'am, saginata hota to tata to the hooklets. But I can definitely see hooklets over here. So this is not Taenia saginata. This is going to be Taenia solium. Sorted? Should we see the life cycle once? And now the life cycle is simple. So you have clubbed both the life cycles. There is a human being. If it's human being with cattle, you will call saginata. If it is human being with pig, you will call it solium. So both the life cycles are the same, only minor changes you will see. Saginata with cattle and Taenia solium is going to be with pigs. So now you will ask me that, fine ma'am, I can see the adult worms also. Let's see what am I going to consume. So either I have consumed undercooked meat from either of these animals. I have consumed undercooked meat from either of these animals. I am going to get this organism. It is going to develop into adult male, male female hoga, eggs banenge. Eggs you already know. If it is a cystode, how is the egg going to look like? How many hooklets hoga? To hexacanth egg banega. We know all of that story. Ma'am, with that hexacanth embryo or with that hexacanth egg, now it is going to come out in the environment. Who is going to eat all those infected things? Either the cattle will eat it or the pig will eat it. Right? And that will go and settle into the muscle of this pig or whatever, pig or cattle jo bhi hai, uske muscle mein jaake those oncospheres are going to develop. They are going to develop into cysticerci. Cysticerci means larva. Common sense, na? If the egg had come out, the egg ultimately has to come out into a larva form. And now tell me, if you are dealing with, say, Taenia saginata, cattle wala, so what is the name of the larva? Cysticercus cellulose or Cysticercus bovis? Ma'am, cattle ke sath bovis hoga. And if you're talking about Taenia solium, then what are you going to call it? Sab kuch. So cellulose is going to be the name of the larva. And now that depends, what do we eat? Whether we get cattle or we eat pig, we are going to get the infection. So now, as I told you, there are two forms. Either there is intestinal or there is cysticercosis, all of the organisms. So now you know that intestinal to dono se hota hai. Taenia solium also causes it, Taenia saginata also causes it. So it is because of the larval form. That is what I was telling you. Larval form meaning either it is Cysticercus bovis or it is going to be Cysticercus cellulose, right? Cysticercus cellulose. So what is the definitive host? Of course, man. Intermediate host depend karta hai. It can be pig also, it can be cattle also. So that depends. But when all this story I knew, ma'am. But when I'm talking about organs, different organs, ma'am, the organ is gonna be with O, so you have to take help of the anda. This is due to the egg, and the egg of whom? The egg of sab kuch, that is Taenia solium. And in that case, man is only the definitive host, man is only the intermediate host, man ही सब कुछ होगा. So please note that. Repeating it once again, when you're dealing with this cysticercosis, and I'm going to tell you different types of cysticercosis and how organs are affected, you will realize this organ involvement is happening only because of the anda, and this is happening only within man. This is not something happening in the animals. So now when I say cysticercosis, you will say, how ma'am, it is happening only because of andas? Yes. So what will happen? The eggs go into the GI. I'll take you back to the life cycle. See, where did you see the adult worms? Can you see the adult worms over here in the small intestine? Imagine they laid down eggs. Where are eggs supposed to move out? Eggs are supposed to move out in the stool, but eggs decided we will penetrate into the GI tract. We will penetrate into the GI tract and then go to different organs, CNS, muscle, eye, so on. And if it goes to CNS, I call it neurocysticercosis. We all know that the most common site is going to be the brain parenchyma, and the most common presentation is seizures. Most common, but different segments of the brain can be affected. Na? Dekho, if it goes into the parenchyma, I agree with you that the patient is going to have seizures. If it goes into the ventricles, I think the patient is going to have hydrocephalus. Of course, it can go into the subarachnoid space. It can go into the spinal cord. So different properties are known. If it goes into subarachnoid space, matlab meninges mein chala gaya. So it can go to different parts of the brain, which I don't want you to learn. I just want you to learn that going into the parenchyma, that is why I said brain parenchyma, and causing seizures. This aspect is going to be the most common presentation. I hope everyone's understood how intestinal type and the neurocysticercosis type is going to be different. So now moving forward, how do you do the lab diagnosis? Of course, especially of intestinal, how are you going to do the lab diagnosis? You are going to do stool examination, because eggs mein to koi difference nahi hai, whether it is saginata, whether it is solium. All the eggs of the cystodes are going to look the same. They are going to have 6 hooklets. All the cystode eggs are going to be the 6 cystodes, so matlab 6 hexacan. They are going to look the same, right? And if you can't see the eggs, what are the concentration methods I taught you in the beginning of parasitology? There are formal ether sedimentation techniques that you can use. So ye to tha for the lab diagnosis of intestinal infection. But what do you do in the lab diagnosis of other situations? Cysticercosis, like for example neurocysticercosis hoga, ya fir neuro is just one organ, na? It can go into the muscle also, it can go into the eyes also, it can go into skin also. So there are so many different places it can go to. What are you going to do? You are going to do a biopsy. I'll share a very interesting case with you. So biopsy, you'll say, "Arey ma'am, pathology wala, pink and blue wala biopsy." Yes. So imagine someone comes to you with a skin nodule. How will cysticercus look under the biopsy? So I'll tell you a very interesting story from one of my residency, where a patient came to us with multiple nodules all over the body. And when a person comes to you with multiple nodules all over the body, and you are a first year resident like I was, I basically thought, oh, multiple chota nodules on the head, scalp, everywhere he had. I was just out of NEET PG preparation. I thought, oh my God, this I have diagnosed as a case of neurofibromatosis. So then I started asking him more history. I said, do you have some pigmented spots? Maybe I thought I was bubbling with knowledge, na? Because I was just out of my entrance exam. So I was like, oh, cafe ole spots dhoonte hain. Let me see whether he has he got ophthal examination done? Does he have leash nodules? I went deep down into neurofibromatosis. But one thing I was like, let me just find out, are these painful? I kept touching the nodules, palpating them, and he was comfortable. He said, no, there is no pain, but yeah, there are lots of nodules. painful nahi tha. Ab neural tumor was not painful. I started doubting my diagnosis. I said, okay, let me just do what I have been told by my seniors. I was sent for FNAC. That day I was in the FNAC OPD. I said, okay, let me not put too much of mind into it. Let me put a needle, baad mein dekhenge. When we put a needle, nothing came out. There was some fluid, white fluid came out. We couldn't see anything under the microscope. Then I told my senior said, let's get a biopsy done. Let's get one nodule removed and let's see under the microscope what is going to happen. And under the microscope, this is what we saw. We saw that there was an organism with a head like this, which had these suckers over here. You can see those round suckers. And it had an extremely convoluted spiral canal. And it had a thin wall around it. This is the classical, ye jo suckers with this extremely convoluted fold. This is a classical case of cysticercus. Remember, this is a classical cysticercus. Remember this head with this spiral tail. This is what we found on a biopsy. Other than that, you can do an X-ray. If you're thinking the nodule is in some soft tissue muscle plane, you can do an X-ray. You can also do a CT scan. Maybe the parasite will get calcified, and you can also do an ELISA testing. What is the treatment? As I said, treatment for all coming out to be praziquantel. So the two most important things, Taenia saginata and Solium, are done. Repeating once again that Taenia saginata, please remember the most important points I'm highlighting over here. Taenia saginata has tata to the hooklets. It's not going to have any hooklets, but the worm is going to have all the features. I'm just going to write all the features because you know everything is more over here, right? Whereas if you compare it with Taenia solium, solium ko God has given all the clinical acumen. Solium ka God says that when you're talking about the larva, that is Cysticercus cellulose, it is going to be present in humans also, it is going to be present in pig also. This larva is going to cause intestinal disease also, and yes, later on when it gives rise to eggs, those eggs are going to cause anda wala, that is other organ involvement also. So sab kuch is going to happen over here, right? Whereas in Taenia saginata, just intestinal infection, that's it. Okay, now although you feel these are the only two Taenias on this planet, no, there is something known as Taenia saginata asiatica and Taenia multiceps. One line about it. When I say Taenia saginata, you start saying, "Arey saginata matlab ma'am, there must be a human, and saginata means cattle." But if I add Asiatica word in front of it, that cattle is going to go away and the host is going to become a pig. Oh my God. This means Taenia saginata asiatica is having the life cycle very similar to Taenia solium. Bas itna sa yaad rakhna hai, nothing else. So please note, everything is going like Taenia saginata. But if I say Asiatica, only thing that I've done is that cattle nahi karna, then go the solium bit. Okay? The next one is known as Taenia multiceps. Taenia multiceps to bilkul hi weird hai. You will realize that humans are not there in their life cycle also. Human has become an accidental host. The primary life cycle is happening between dog and sheep. The life cycle is happening animal. Ye kiske jaisa lag raha hai? What I'm going to teach you next. This is sounding like the dog tapeworm. So, oh my God, this multiceps though has totally left the family only. Multiple direction mein chala gaya. Multiceps has gone in multifold direction. It is going to be having a life cycle between the dog and the sheep, just similar to Echinococcus, dog tapeworm. Human has become an accidental host. That is all that I wanted to know. So, Taenia saginata is like saginata, but if you add Asiatica, it starts looking like solium. Taenia multiceps though has gone in multiple other directions. It has started behaving like the dog tapeworm. So, why don't we study the dog tapeworm next? Guys, let's move on and study the dog tapeworm, that is Echinococcus granulosus. Come on, you know it. Isme there is no tata, nothing happening. So you know for a fact that over here there are 4 suckers and there are gonna be 2 rows of hooklets. Everything is going fine. But what was the exception? Why am I calling it dog? Because here the definitive host and intermediate host is not man. The concept of calling it dog was that man is going to be an accidental host by having some contaminated food or water. Man is going to be the accidental host because definitive host will definitely be the dog. That is why you call him dog tapeworm. And intermediate with sheep and other animals. So if you primarily see a life cycle, this is easiest to pick up. I'll tell you why. Look at the life cycle. Ma'am, primarily the life cycle is going between dog and sheep. Dog and sheep. Human तो बिल्कुल side पे accidental host है. So definitive host is gonna be the dog, intermediate host is gonna be the sheep, and by chance if we end up having some contaminated food and water by some eggs, if my contamination has occurred in the food and water with some eggs, that is gonna occur in a human involvement. But like I said, not only are we accidental, we are also dead ends. Not only are we accidental, we are also dead end hosts that we have. So let's have a look at the disease that it's causing, guys. This is going to result in the very, very famous hydatid cyst. What do you see over here? You have multiple pearly white cysts that are seen. Multiple pearly white cysts that are noted, right? So imagine if I see what is inside. Let me look at this cyst altogether. Iska kya layers hai, what is the composition? So if I look at it's a very pearly white structure, right? What is inside all these? Multiple cysts are there. What is inside all this? It has a fluid which has a pH of little acidic, 6.7. It has certain salts, and this fluid is antigenic. This means if I puncture and I rupture this fluid, the fluid can cause anaphylaxis and death in a patient. Do you want to rupture it now after listening to this? Do you ever want to do an FNAC in this case? No, FNAC is contraindicated. Remember, the fluid which is little acidic, which is going to have little salts, but most important, it is antigenic. It is definitely going to cause anaphylaxis. Do not puncture this cyst. FNAC is contraindicated. So this you've understood. But now I want to ask you that if you just surgically remove it, puncture nahi kara, surgically pura remove kara, if you look at this under the microscope, how is it going to look like then? What are the layers of hydatid cyst that you notice? What are the layers of hydatid cyst? So I see there are 3 layers: pericyst, ectocyst, endocyst. So first and foremost, pericyst is something which people have made. Pericyst is something which people have made. Matlab I have made. It is host derived. It is host derived. It is going to be nothing but inflammatory cells. Tell me, if a parasite comes into your body, you will make some neutrophils, monocytes, macrophages. You will make some inflammatory cells, na? So this entire inflammatory cell layer, where you're seeing all the normal part of the maybe liver mein hua ya lung mein hua ya jahan bhi hua, over there, plus all these inflammation, eosinophils, neutrophils, whatever inflammation is there, that becomes the pericyst. Okay? Then this to you will say, this is ma'am, this is to hamara contribution. What is parasite making? Parasite has ectocyst and endocyst. Ectocyst on outside, endocyst on inside. So what is the next layer? The next layer is ectocyst. What is it looking like? It's looking like a pink color line. Ectocyst shows you the famous paintbrush appearance. Very, very, very famous question. Ectocyst shows you the paintbrush appearance. And what do you see inside? Ma'am, finally inside I'm seeing all the organisms. These are the hydatid cyst wala organisms. So instead of just calling them organisms, they call it brood capsules. So when they use this very, very big term called, oh, brood capsules, kuch nahi ho raha, germination, new organisms are being made. So I'll write it in simple words. It is the organisms, or you can say, is this the germinal layer? Is this the germinal layer? Because all the organisms are forming over here. And finally, you'll say from outside to inside, if I have to go, outer layer is pericyst, which people have made host derived. Then ectocyst is going to look like a pink color paintbrush appearance. And endocyst is where all the brood capsules are formed. So what is there in the fluid? In the fluid, you see these hooklets, because obviously Echinococcus has hooklets, na? So you will see these hooklets also that are present. So please note, and if you go back to your general microbiology, I have taught you that hooklets of hydatid are Zn stain positive. So now tell me, guys, that once you have read all of this, you have analyzed that, okay, they are pearly white, their fluid is very, very dangerous, you've done the layers, tell me the organs. What is the most common site? The most common site, as we have been reading over here, is going to be the liver, and is usually the right side of the liver. Right side of the liver, in which it obviously means that the patient is going to have hepatomegaly. The patient is going to have hepatomegaly, and in severe cases, it can complicate as portal hypertension. Okay? Second most common site is going to be the lungs. Lungs means that the patient is going to have cough, and there's going to be sputum, there could be chest pain. These are the different things that lung involvement happens. So kind of expected. Liver involvement hoga, so there's always hepatomegaly. Lung involvement always cough. So remember, most common site is the liver, and the second most common site is going to be the lungs. Then after that, to any other organ of the body can be affected. There is no end to that. But moving forward, this was all about the features. How do you do the diagnosis? Remember, you can do imaging. I think everyone knows that very famous radiology sign that is known as the water lily sign, that is so shown by hydatid cyst. So hydatid cyst shows you the water lily sign. Do you want to do the cyst fluid examination? Usually, will you want to do an FSGC? Not at all. It is contraindicated. But if you see a cyst fluid, what will you see? I already know. I'm going to see the presence of hooklets, and we have already studied that the hooklets are acid fast, Zn stain positive. These are the two tests where they ask you a lot of questions. एक टेस्ट है पुराना वाला टेस्ट, जैसे स्किन के लिए you have Montus ना, skin test. TB के लिए है ना, TB के लिए you have Montus. For this also they used to have a skin test called Cassoni test. No one does it now. It is totally obsolete. So just know Cassoni test. You know why? Because in Cassoni test, they used to actually inject a little bit of fluid. And since that time, I have been shouting, cyst fluid is very dangerous. Cyst fluid causes anaphylaxis. So imagine if I inject cyst fluid into someone, that person might die only. They said, oh, this is a very dangerous test. Ye wo type 1 hypersensitivity, anaphylaxis wala test hai. Please remove this. Don't do this. No one does it now. Now what is done is ARC5 immunoelectrophoresis. That is the newer test. So one old test question comes, one new test question comes. Old test mein Cassoni test, no one does it. Risk of anaphylaxis, very, very deadly. I don't want to get into it. New test is ARC5 immunoelectrophoresis. Now you will say that, ma'am, FNSC to kar nahi sakte. How are you going to treat this patient? There is a technique called pair. The first P will be a little worrisome. You know what we do in pair? We puncture the cyst. You will say, ma'am, since then you were only shouting, don't puncture, cyst is very dangerous. Now you are only saying puncture the cyst. But yeah, as soon as you puncture, you take out all the fluid. You aspirate all the fluid. The fluid should not spill into the person's body. Then it will cause anaphylaxis. Immediately aspirate. So for example, if this is the liver and over here you have the hydatid cyst, first you're going to puncture and immediately you will take out all the fluid. You will aspirate it out. And you know after that what you'll do? You will give an injection. You will give an injection of 95% ethanol. Why? Because that is a scolicidal agent. It is gonna then kill the scolices, the brood capsules, the hydatids. It's gonna kill those. And once you have injected ethanol, you can't leave the ethanol there. Once all of them have died, you're gonna again re-aspirate it. You're gonna again re-aspirate it out. So I hope everyone's understood what is the pair technique. First you puncture, but don't worry, immediately take out all that dangerous fluid, aspirate it. Then you inject, give an injection of 95% ethanol, which means all the scolices and organism will be killed, and then you re-aspirate that fluid. Puncture, aspirate, injection, re-aspirate. That is what you do for dog tapeworm. Echinococcus granulosus. What am I going to do? Change one word over here, make it Echinococcus multilocularis. So you'll say, what is this multilocular thing? I'll say, hang on. Earlier, hydatid cyst was looking like a nice cyst like this. Multilocularis is inside every cyst there will be multiple cysts. Multiple locules are going to be there. So this is also known as the alveolar hydatid cyst. Now as soon as I say, oh, you know what I'll do? I'll tell you I would have also done that if I would have been in your place. As soon as I say Echinococcus multilocularis is alveolar hydatid cyst, students say, oh, this means the most common site must be the alveoli. No, here also the most common site is the liver and the second most common site is the lung, which was the case in your previous thing also. In the previous situation also, Echinococcus granulosus mein also, the most common was liver and second most common was lung. Here also I'm saying the same thing. Most common is liver, second most common is lung. Then why are we calling it alveolar hydatid cyst? Because the structure looks like alveoli. Multiple locules. That looks like an alveoli. That is why we are calling it the alveolar hydatid cyst. Okay, so do you want to see in dono ka life cycle? Because that I have not seen. So for example, now how is this life cycle going to be different? You'll say, ma'am, I can see human to isme bhi alag hai. Human to isme bhi accidental hai, fine. But this story has changed. Over here, you can still have the dog or the wolf, whatever. The story of the intermediate host has changed. Over here in multilocularis, you're going to have a chota sa rat. So now compare. See guys, if I go back to my hydatid cyst wala Echinococcus, we label it now. If I talk about Echinococcus granulosus, which was dog tapeworm, dog ya wolf, dono chalega. Dog ya wolf, dono chalega. But over here, you had to see a sheep. you had to see a sheep, whereas over here in Echinococcus multilocularis, I am seeing dog ya wolf chalega, but over here I am seeing a rat, and if I see a rodent, I know this is kuch problem hai. This is the Echinococcus multilocularis that is happening over here, the alveolar hydated cyst. Now, coming towards the end, the one who gave us life lessons, the one who is the smallest in size, the one who has only a single host, that is humans, and who has how many rows of hooklets? Only a single row of hooklets. So I told you the life lesson, na? Limited resources hai, but it has made the maximum out of it. This is the most common cystode infection. Do you know how is the life cycle going to look like? That I'll show you in a while exactly. But there is one cousin brother of this that I want to tell you. This is to H. nana, and we know everything about H. nana. H. nana is going to cause a lot of intestinal infection. Okay? There is a cousin brother of H. nana known as H. diminuta. See, now that is how microbiology is. If I would have thought of diminuta word, I would have felt this is the smallest organism. Diminuta, minute, but aisa nahi hai. I know that H. nana is the smallest, so they call H. nana as the dwarf tapeworm because H. nana is nano. That is how we've learnt it. H. nana is the nano car that we have, dwarf tapeworm, whereas H. diminuta is a rat tapeworm. Why rat? Because you will say, ma'am, ab compare karte hai. When I compare H. nana versus H. diminuta, firstly I need to know their names. This is a dwarf tapeworm. This is a rat tapeworm. Isme ek hi host hai, single host, human. Over here you've called it rat, so along with human there must be a rat also, na? That is why you've called it rat. So ho gaya different. Now you will say, how do their eggs look like? You will say H. nana looks like any other cystode egg. It's going to have the same. Let me show you that egg again. Do we all remember this egg that we did? How many hooklets will it have? It will have 6 hooklets. Will it have all these yolk granules? Hai na? Yolk granules hoga. It will have those 2 polar knobs also. All of that, ma'am, that we have studied earlier, H. nana ka to waisa hi chalega. Just like any other cystode egg it's gonna be. But when I talk about H. diminuta, look at the egg in front of you. 1, 2, 3, 4, 5, 6. Hooklets to same hai. Outer membrane is there. Inner membrane is there. But what happened to all the mess in between? Do you see any yolk granules? No, the yolk granules are missing. Do you see any polar knobs? No, those are also missing. So the polar knobs and the yolk granules are missing, and that is H. diminuta ka egg. So basically whatever mess was happening over here, na, the yolk granules and polar knobs, wo chale gaye, that is H. diminuta, and that is how you will make a final differentiation between these two, which is very, very important for all of you to know. Please note, repeating, H. nana is nano, it is chota, it has one host. Diminuta sounds diminuta, but that is how microbiology is. What sounds is not the case. This is not chota, this is rat tapeworm, because with humans there is rat. Now if I show you the life cycle, things will become simple. If it would have only had a human, the life cycle is happening between human, you would have called it H. nana. But if I say with human there is a rat also involved, you would have called it H. diminuta. Sometimes in H. nana also a rat can come. Aisa bhi hota hai. But again, this is not something I would want you to know. The best is just think about how there's a life cycle in the human and how there's one in the environment. Human is going to be the H. nana ka life cycle. Okay, so now moving forward, what are the clinical features? Because I've understood it's an intestinal problem, but what are the clinical features? Like any other intestinal problem, abdominal pain, nausea, vomiting, maybe diarrhea, and like any other condition, the treatment is going to be with praziquantel. So nothing problematic over there. Going all the way back, guys, to the first slide which I taught you, which I hope now will make a lot of sense to you guys, because that time you might be feeling a little lost. Host revise karne jaldi. Tell me the host of H. nana, single host. H. diminuta, human and rat. Okay, Diphyllobothrium, Diphishobothrium. So human and two fish. Okay. Then we had Echinococcus dog tapeworm. So dog, sheep, human side pay, accidental. Taenia, solium and Saginata. Human to hai hi. Saginata is cattle and solium is gonna be the pig. So now you are ready maybe for some MCQs after so much of listening to me. So maybe you can start off by doing this one life cycle over here. Let's begin. Can you identify the life cycle? Best is, I see one animal here and human ko aisa kaise side pe, you have ignored. So there is a dog and there is a sheep. If there's a dog and the sheep, I know I'm talking about the very famous Echinococcus granulosus. This is the dog tapeworm, and human is going to be the accidental host. Very, very good. Let's pick pick up the next one. Identify the life cycle. I see a human being over here, and I see one big wala fish over here, and I see one chota wala fish over here, which is Cyclops. So if it is human to chota wala fish to big wala fish and back to human, so that is Diphysiobothrium latum. Life is becoming easier, isn't it? Coming to the next, which of the following is not a cystode? Wow, what a question. So D. latum is a cystode, Taenia saginata, Echinococcus granulosus. Schistosoma is not a cystode. I'm going to teach you in the next chapter. That's a trematode. So that's the answer over here. Next question, which of the following has grooves on its head for attachment? Doesn't have suckers, no suckers, but grooves. And remember, two grooves. Diphysiobothrium latum. Di means two. It has two grooves. Next, infective form of this Diphysiobothrium latum. So I had said it had 3 hosts and it had 3 larvae. And out of them, the L3 larva was plerocercoid. Plerocercoid larva was the infective form that you had. Next question. ARC-C5 counter immunoelectrophoresis on serum is a diagnostic test of, I told you again and again, this is the new wala test of hydated. Remember, I said for hydated one old wala test, Cassoni no one does, and this ARC-5 immunoelectrophoresis now is being done. That is done for hydated. Coming to one last question. Larval form of which of the following cystodes is not seen in man? Not seen in man. So first and foremost, you will say that Echinococcus granulosus ka to dog tapeworm hai, usme to once it comes into us, what can I say? Now the egg is going to come into us. When I say I have Taenias that are mentioned, Taenia saginata, Taenia solium, Taenia multiceps. So did I tell you that Taenia solium was sab kuch. The larva was seen in the animal also, in the human also. Taenia solium was sab kuch. But I told you Taenia saginata. Taenia saginata is something which is definitely limited only to larva. Batao, tell me the name of the larva. Saginata, ma'am, this was cattle. Cattle matlab this was Cysticercus bovis, and this was only present in the cattle. This was not seen in man. So that is the answer over here. And yes, with that we wrap up the entire discussion of the cystode chapter. Tapeworms are done. So now we are going to discuss the Hematazoa family, which is actually a part of the sporozoites. Remember, we were doing something similar to this called coccidian parasites. We are now going to go on and start off with the sporozoites, which will include malaria and babesia, of which malaria is what I'll start with first. So before I begin, something from PSM, World Malaria Day, April 25th, and the malaria month in India, of course, we know is going to be June. Right? Okay, so now let me tell you or make you basically introduce you to the different malaria or species that we have. So we have Vivax, Falciparum, Malariae, Ovale and Knowlesi. And what are they known as? Firstly, Plasmodium falciparum is known as malignant. If you can see, all of the others are benign. Falciparum is malignant. Malignant doesn't mean any cancer. Malignant means it has a more aggressive course, and that is going to be cerebral malaria, right? That is going to be cerebral malaria. Now, what do I mean by others are benign? They don't cause cerebral involvement, so that is also sorted for us. But what do I mean by tertian? Tertian refers to 3 and quartan refers to 4, hai na? So basically, when I'm saying that fever comes on the 3rd day, every 3rd day, this means the cycle must have gone on for 48 hours, 2 days, then the 3rd day fever comes. So basically, the cycle is going to go on for 48 hours, that is tertian. Over here also 48 hours, that is tertian. For ovale also 48 hours, that is tertian. But when I say Plasmodium malariae, that is quartan, means fever comes on the 4th day. After 3 days, the 4th day fever comes. 3 days matlab 72 hours. And finally, Knowlesi is quotidian. Quotidian means the cycle is only for 24 hours because fever is coming daily. So repeating, I can say that all of them are tertian. Tertian means 3rd day fever matlab after 48 hours. Only malariae is quartan, and Knowlesi, the one that we hardly see in India, it is seen in Malaysia. I'll talk about it in the end. That is going to be daily fever. So now I want to ask you, what is the definitive host? We all know over here we are the intermediate hosts. We are not the definitive host. Definitive host is FAM, female Anopheles mosquito. That is going to be the definitive host. So first you will ask me, mosquito gives the disease to us and mosquito takes also something from us. Give and take hota hai between mosquito and us. So firstly, what is going to, so if I take, like for example, I am a human being, what is the form that I'll get from the mosquito? What is the form that I'll give to the mosquito? So what will I give to the mosquito? If I ask you, what am I going to give to the mosquito? You are going to say give matlab gametocytes. Ma'am, you will give gametocytes because mosquito is a definitive host. Mosquito को वो पूरा sexual reproduction कराना है male female gametocytes से. So you will give the gametocyte to the mosquito. And what will you take from the gametocyte? What will you take from the mosquito? If the mosquito is coming and biting you, saliva आ रहा है, then saliva के through you are going to get sporozoites. SS. Saliva के through you are gonna get sporozoites. But if you have some blood transfusion, basically if it's blood related, either it's a blood transfusion or maybe it is mother to child transmission, then they are going to be T for T, that is trophozoites. As easy as that. Repeating, what are you going to get? If I get the saliva of the mosquito, I get sporozoites. If malaria is coming by a blood transfusion, I get trophozoites. Whereas what am I going to give to the mosquito? We give gametocytes. So I think we are ready for the life cycle. Firstly, this is not a life cycle that you'll get for identification ever, because as soon as you will see that there is a human being over here and there is a female Anopheles mosquito mentioned over here, you know it's a case of malaria. So what am I going to do? Now tell me guys, over here the female Anopheles mosquito is taking a blood meal, matlab saliva. Saliva is going to be injected in me, means which form? S for S. The sporozoites are going to be injected. So here we've been bitten and the sporozoites have been injected. So the first cycle that it has to go through, you will say, ma'am, ye to RBC wala parasite hai. It is supposed to go to the RBCs, correct? It is supposed to go in the erythrocytic cycle. However, please remember, this is before going there, it is going to go into the exoerythrocytic cycle. So what is the exo? Outside the red blood cell. Outside the red blood cell basically means it's going to go somewhere in the liver. So what happens? What came in our body? We had sporozoites in our body. Sporozoites are gradually going to infect which cell? They are going to infect the liver cells. And what are they going to form? They are going to form the schizons. Schizon banega, schizon rupture hoga. Schizont is going to rupture. This is exoerythrocytic cycle because it's not in the red blood cells. It's outside the red blood cells. So sporozoites will come, schizont will form, it will rupture. So that is what will there. So ruptured schizont, say what is going to happen? Now it's going to go and get deposited on the red blood cell. Now it is the time that it will go and get deposited on the red blood cell. So now it has entered the erythrocytic cycle. So for example, if this is a red blood cell, guys, let me label this. How will I say that, okay, Plasmodium vivax hai, so how will it come and bind? If it is Plasmodium falciparum, how will it come and bind? So please note that for Plasmodium vivax, for Plasmodium vivax to bind, all of us have something called Duffy antigen. All of us have Duffy antigen. So Plasmodium vivax binds to Duffy antigen. And if Plasmodium falciparum will come, what will it bind to? There is something which is known as BASI gene. Plasmodium falciparum is going to bind to BASI gene. BASI gene is CD147 if you want to learn, but I don't think that is important information. So Plasmodium vivax will come and bind to Duffy antigen on the red blood cell. Plasmodium falciparum will come and bind to BASI gene on the red blood cell. So finally it has taken entry into the red blood cell. And what is going to happen in the red blood cell cycle? TSG. TSG ka matlab is not gonna be tumor suppressor gene. TSG are the stages of malaria. T for, I'm gonna teach you, trophozoite. Trophozoite se kya banega? Schizont banega. You will say, ma'am, after this schizont, either I can have, see, there are two things. From this trophozoite, either there is going to be a schizont formation, schizont will rupture, again that cycle will keep on going on. So remember, when this schizont ruptures, that is when patient has fever. So every time the schizont will rupture, patient has fever. Every time the schizont will rupture, patient has fever. So one option is that the trophozoite is going to form schizont and schizont rupture hoga, wo वापस RBC पे जाएगा, the cycle is going to go on and on. However, the trophozoite can also form gametocyte, and this gametocyte, male, female, जो भी gametocyte होगा, whom will this be given to later on? This will be given to the mosquito. So now, please remember, the mosquito has got the male and the female gametocytes. What are they going to do? Of course, they're going to mate, and they are going to result in the formation of ookinete. Ookinete is something which is motile. Ookinete is motile. After that, it's going to become non-motile because it's going to become an oocyst. that is going to become non-motile, that is an oocyst, and that ruptured oocyst will then rupture and will release what? It will release all the sporozoids. So now these sporozoids are going to come and stay in the saliva. So when the mosquito will bite us, the sporozoid saliva says sporozoid will enter into us. So what was this? What kind of a cycle is this, ma'am? This is sporogenic cycle. This is the sporogenic cycle. So I call it the sporogony. This is sporogony, and let me tell you, please note, this is gonna take 10 to 14 days to occur. This cycle in the mosquito takes 10 to 14 days to occur. So you know what is this known as? This is known as the extrinsic incubation period. See, whatever had to happen in us would have been inside our body intrinsic. Whatever is happening out there is gonna be extrinsic incubation period. So I want all of you to quickly help me with this. What all did you study for malaria? If I had to summarize that very, very quickly, chalo, let's do that. Firstly, you will have a human being over here, and along with that, you will have someone biting it, that is female Anopheles mosquito. If it is the saliva of the female Anopheles mosquito coming, this means the sporozoids are going to come to us. As soon as the sporozoids come, there is one cycle known as the cycle in the liver, and then there is one cycle which is going to happen in the red blood cells. So, the red blood cells hai, that is the erythrogenic cycle, and the other one is going to be exoerythrocytic cycle because it's outside the red blood cells. So, what happens? There is going to be schizont that will be formed. Every time the schizont will rupture, when the schizont will rupture, all the merozoites are going to go, and they are going to go and attach all those ruptured schizonts. Se jo merozoites niklenge, they will go and attack the red blood cell. Okay, in the red blood cell, how are they going to form? There are three stages, TSG, trophozoid schizont. So ya to schizont rupture hota jayega, trophozoid schizont, that will keep going on. Or the trophozoid can take a root and form gametocytes, means there is going to be male-female gametocytes, which we are eventually going to give back to the female Anopheles mosquito. In female Anopheles mosquito, these male and female are going to form an ookinete. After an ookinete, it is going to form an oocyst. And from this oocyst, all the sporozoids are going to be released. So this is happening as sporogony. This is sporogony, and this is going to take 10 to 14 days. That is the extrinsic incubation period. I hope you've understood. Itna detail mein no one will ask you, but this is only for your understanding, because now you can let me know that how much of gametocytes was given to the mosquito. How many gametocytes have to be there given away to the mosquito, that we are saying that, you know, the infection has gone to the mosquito. So at least 12 gametocytes have to be given per microliter of blood. Please remember, at least 12 gametocytes. When you are giving, at least 12 gametocytes must be present per microliter of blood so that the infection can be given to the mosquito. I hope everyone's okay with this, because now I'm going to start off with the overall incubation period. So what is overall incubation period? Kitna time liver mein laga plus kitna time blood mein laga. What am I saying? The overall incubation period is going to be this. How much time did this process take in the liver? How much time did this 1 or 2 cycles of process in the RBCs? That is the overall incubation period. Everything, let me tell you, for vivax and ovale is always going to be similar. 13 to 17 days. Everything for vivax and ovale is going to be similar in the story. So 13 to 70 days. Now falciparum is going to be fatafat. Fatafat is going to be 12 days. So it's a little shorter than vivax and ovale. Then we have malaria. Malaria is going to be a very lazy one. Lazy one matlab it's going to take 1 month. So remember, malaria ko month lagta hai. Malaria ko month lagta hai. And knowlesi to knows it all. Knows it all means it's going to be even faster. Knowlesi knows it all. So it's going to be a very less incubation period of 8 to 10 days. Dobara karte hain. Vivax and ovale are friends. Everywhere you will see vivax and ovale are going to be friends. 13 to 17 days. Falciparum thoda sa fatafat, 12 days. Knowlesi knows it all and is going to happen very, very less incubation period time. So 8 to 10 days. And this malaria is going to take 1 month. Okay, 28 to 30 days. And what is the incubation period? The liver and the RBC, dono ka schizogony I have combined. And then I've called it. Now you need to know 3 definitions out here. What is cytoadherence? What is rosetting? And what is agglutination? And this is specially, it can be seen in all, but it is specially with respect to Plasmodium falciparum. So what I'm going to do over here, we'll draw one red blood cell. And before I start, why am I focusing on Plasmodium falciparum? Because which organ does it go and involve? It is definitely involving the brain. It is causing cerebral malaria. So please note what is happening over here is that, for example, if this is a red blood cell and this red blood cell has been infected by Plasmodium falciparum, and if this is a blood vessel, guys, what is the lining of the blood vessel? Lining of the blood vessel, we all know by now, are the endothelial cells. So you know what these red blood cells do when they are infected with Plasmodium falciparum? Plasmodium falciparum starts making some knobs. That is what Plasmodium falciparum does. It will start making some knobs known as Plasmodium falciparum erythrocyte membrane protein. You really don't have to know the full form. I told you just to kill the curiosity. So erythrocyte membrane protein or Plasmodium falciparum, basically it is making knobs. You know why is it going to make knobs? Because these knobs will go and bind to ICAM that is present on the endothelial cells. So can I say the cells will get adhered? There is cytoadherence. So this concept of the knobs binding to ICAM1 is referred to as cytoadherence. One thing. Next, if all these cells, ये जितने भी knobs वाले cells हैं, if they start getting agglutinated with each other, now I'll draw lots and lots of RBCs. ठीक है, I'm going to draw lots and lots of RBCs, and all of them are infected with Plasmodium falciparum. So all of them are going to agglutinate. All of them have these knobs. Knobs दिख रहा है मतलब Plasmodium falciparum. So what is agglutination? All the parasitized red blood cells agglutinate. All the parasitized red blood cells are going to get agglutinated, or you can say clumped. That is auto-agglutination. And what is rosetting? कि ये तो parasitized थे, तो they were agglutinating. But then we do have some red blood cells which are normal, na? Some red blood cells are totally normal. Now you know what will happen in rosetting. Rosetting mein all of them will also come and combine with each other. So please remember the definition of rosetting is that the parasitized and the unparasitized cells will clump. Parasitized and the unparasitized cells are gonna clump, and that is known as rosetting. So repeating, what is cytoadherence? Adherence means that the cells are going to stick onto the blood vessels via which receptor? ICAM1. What is that's why I call it auto-agglutination. Auto matlab apne aap mein. The parasitized cells apne aap mein they are gonna agglutinate. But what is rosetting? Rosetting is going to be the parasitized and the unparasitized cells. These are all going to clump together. Sorted? Should we move on to another form of malaria? Because I now keep on telling you that, okay, this is the malaria that has happened to you with female Anopheles mosquito. But I also told you that there is a malaria that can happen via blood transfusion. And can you help me with this information? That if you're talking about blood transfusion, which is the form that you've got? You've got trophozoite form, T for T. So now going all the way back, you will realize that this is the stage you've got the malaria at. ये वाला पूरा cycle तो गया. Nothing is gonna now directly you've got trophozoite. So you just have to deal with this cycle. You don't have to deal with the liver wala cycle. So that exoerythrocytic cycle is gone. The exoerythrocytic schizogony is not seen. This means that the incubation period is gonna be very, very short. Simple. In blood transfusion malaria, when one entire cycle has only not been there, this means the incubation period is very short. Now, what is this that is written? Relapse, hypnozoite. So it's important that we do 3 definitions. What is pre-patent phase? What is relapse? What is recrudescence? But pehle ek ratta laga lo. When I will use chota wala word, that is relapse, you will put it up in the chota wala malarias. That is vivax is a chota wala term and ovale is a chota wala term and relapse is a chota wala term. Okay, so vivax and ovale are going to show you relapse. Recrudescence is a really lengthy name. So Plasmodium falciparum is a lengthy name. Plasmodium malariae is a lengthy name. So jo recrudescence hai, that is going to be present in the lengthy wala name. Rat liya? Relapse is present in vivax and ovale. Anyway, I was telling you vivax and ovale are brothers for lifetime, and recrudescence is seen in falciparum and malaria. Now I can tell you the definitions. So what is firstly? Let's begin with what is pre-patent phase. Pre-patent phase का definition है from the time that the saliva of the mosquito entered the sporozoites into me to the first parasite that I form in the blood. Going back from the time the mosquito gave me a sporozoid to the first parasite that I form in the blood, that is the pre-patent phase. Basically, I am putting like patent karna, something I'm putting on my name that yeah, I have also made one parasite. So from the time of the entry till I making the first parasite, making it patent that I have made malaria, that is pre-patent phase. What is relapse and what is recrudescence? See, relapse means that there is gonna be a comeback. Relapse हुआ. Comeback क्यों हुआ? Somewhere malaria slept off in your body, and after some time it woke up. Means, where did it sleep off? Remember over here, in the liver, sometimes there is gonna be formation of hypnozoids. Hypnotize हो गया. As soon as the sporozoids entered from the mosquito, in the liver they went and वो hypnotize हो गए and they slept off. And later on, they suddenly got out of their hypnotized state and they got activated. That is known as relapse. So remember, relapse refers to what? It is gonna be the hypnozoids which are getting activated, and that is what you will see in the liver, right? So now you understand. In the previous one, when I was teaching you blood transfusion malaria, when I said that the entire liver wala cycle is not going to be there, so जब liver wala cycle नहीं होगा, तो hypnocytes will never form, and hypnocytes are never formed. This means relapse will never be seen. Relapse is never seen with blood transfusion. So simple, in blood transfusion malaria, your direct cycle starts from trophozoites. Trophozoites means RBC wala cycle. Liver wala cycle is only not there. When the liver cycle is not there, this means the hypnozoites will never form, and if they will never form, blood transfusion malaria will never have a relapse. Who will have a relapse? I told you chota wala names, that is Vivax and Ovale will have a relapse. Understood? Okay, what is recrudescence? Recrudescence is you gave treatment, but there was a problem in the treatment. So this is gonna be a case of inadequate treatment. Or you can say there is some resistance to the treatment. So this is a treatment related thing, and it is seen in all the long things, na? Falciparum and malaria. So repeating once again, relapse is a hypnozoid sleeping and waking up. Recrudescence is a problem in the treatment. Relapse chota word Vivax and Ovale mein hoga. Recrudescence long word Falciparum and malaria mein hoga. Understood with this? Now we move on to the clinical features finally of malaria. Then the diagnosis. So clinical features include benign malaria has febrile paroxysms. I think you know this from day-to-day life. What is febrile paroxysms? First, the patient is going to have a cold phase. Cold phase ka matlab there is going to be chills that are going to be there. There is going to be shivering that the patient is going to have. Along with that, there is a hot phase. Basically means that the patient is going to have fever, and then the patient is going to sweat it out, and there is going to be fall in the fever. So these are known as febrile paroxysms that occur. But why do they occur? When do they occur? You know when do they occur? Whenever, now going back, whenever in the red blood cell, every time a schizont will burst, jab se water balloon burst hoga, that is when there is going to be fever. So every time that happens, there is going to be fever. That means that, for example, there is erythrocytic schizogeny. Every time there is erythrocytic schizogeny, the RBCs are rupturing. That is when febrile paroxysms occur, and they ask you the most important cytokine for fever over here is TNF-alpha. The most important cytokine for fever, TNF-alpha. So remember, fever is because of the RBC wala cycle. This was benign malaria, that cold phase, hot phase, sweating phase. But what is the malignant malaria that I told you? Malignant malaria was associated with Plasmodium falciparum, isn't it? And that is cerebral malaria. Cerebral matlab brain involvement. There is headache, there is nausea, confusion, paralysis, coma. All brain related things are gonna occur. I want to ask you something from pathology. Guys, come on. Is there any granuloma that you see in malignant or cerebral malaria? There is something known as Dirk granuloma that I have taught you in your pathology lectures, in your RR also, in your snapshot also. So many places I have taught you. So I hope you remember. Dirk granuloma is going to be there in Plasmodium falciparum, everything to do with the brain. What else? You know, RBCs are breaking. At the end of the day, RBC ka problem hai. RBC breakdown is going to occur, and if RBC breakdown is going to occur, this means there is going to be hemoglobinuria, hemoglobin in the urine, because it is going to be intravascular hemolysis. And that means this can be known as black water fever. Patient will say, I'm passing black water in the urine. That is nothing but RBC breakdown. Next, there can also be nephrotic syndrome. You go back to your renal pathology, and I have taught you that nephrotic syndrome can occur because of malaria. Yes, I have taught you that. But which malaria? Now I'll tell you. It is a feature with Plasmodium malariae. It is a feature with Plasmodium malariae that nephrotic syndrome can occur. I have taught you this way back. And I've even taught you which type of nephrotic syndrome. I've taught you membranous glomerulonephropathy. Go to MGN in your pathology lectures, and it's written over there. What else? Sometimes, and in many patients, you must have seen that splenomegaly bhi hota hai. That is known as tropical splenomegaly. But for the spleen to enlarge, it should be a long term. Spleen will not enlarge in 4 days. For the spleen to enlarge, it has to be either long term infection or repeated infection. And tropical kyun bolte hain? Because this is very commonly seen in tropical countries. So firstly, for the spleen to enlarge, it should be a long-term malaria. Tropical because it's occurring in tropical countries. Also, why does the spleen enlarge? The spleen enlarges because there is reticuloendothelial hyperplasia. Kitna fancy naam bola. What are reticuloendothelial cells? Nothing but macrophages. So macrophages are always given one fancy name called reticuloendothelial cells. So remember, tropical countries, splenomegaly, long-term infection se hoga and reticuloendothelial cells are going to be affected. Finally, if there is any circulatory failure that happens with malaria, if there is any circulatory failure that happens with malaria, you're going to refer to it as algid malaria, right? So these are the different types of malaria. But before I go on to the other parts of malaria, I want to quickly mention about this Plasmodium knowlesi, which I was not talking much about. Only thing I told you was it is quotidian. Quotidian means that there is going to be fever daily, 24-hour ka cycle hota hai. And secondly, I told you that this is something which is not seen in India. I told you the incubation period, it is a knows it all. So jaldi incubation period hoga within 8 to 10 days. And please remember, this is M&M. Malaysia mein tha from monkeys, not really reported in India as of now. Before I start with lab diagnosis, I want to make all of you familiar with the concept of pathology. Which are the people who are immune against malaria? So, pehle to please note, for malaria to enter into the red blood cells, especially Plasmodium vivax, if it has to enter into the red blood cells, it needs an antigen called Duffy antigen. So, simple. All of us have Duffy antigen, so malaria will enter us. People who don't have Duffy antigen, malaria will not enter them. So, you might feel, array, Duffy antigen nahi hai, problem hoga. Patient is lucky. He doesn't have Duffy antigen. He's actually had a benefit. He's not going to have vivax infection. He's immune. Secondly, if you talk about all these hemoglobin and RBC problems, sickle cell trait, thalassemia, or G6PD deficiency, ovalocytosis, if you realize, dekho, hereditary spherocytosis, ya ovalocytosis, G6PD deficiency, don't you feel the RBC lifespan has only gone down in them? Don't you feel over here the RBC lifespan has overall gone down in them? Now, when the RBC will only not survive, so what will the malaria survive? Malaria survives in RBC. RBC is only not surviving over here, so person indirectly becomes immune. In sickle cell and thalassemia, the hemoglobin is only low. The hemoglobin production is only not occurring. Rather than saying hemoglobin is low, I will say the hemoglobin production is not occurring. Now, when again the red blood cell is not surviving, hemoglobin is not surviving, how will malaria survive? And fetal hemoglobin can also make it immune because fetal hemoglobin keeps so much of oxygen affinity that organisms cannot grow. So remember, all these conditions and the absence of Duffy antigen, all of them make it immune to malaria. We are ready for the lab diagnosis. I will tell you a long list of lab diagnosis, but I have a request. Please do not take my bread and butter away from me. So remember, whether it is a pathologist or a microbiologist, malaria season सबसे beneficial season होता है हमारा, which means that light microscopy is still the gold standard. You might have CART tests and you might have a million other tests, but light microscopy is still the gold standard. Always remember. So first, I will start off with here. I'll keep coming back to this slide. Okay, I'll keep coming back to this slide one by one. Let's start with light microscope. So what do I have over here? I have a slide. Of course, we'll have to make a slide for this gold standard. We make something known as a thick smear. You can very well see what is a thick smear. I've taken one drop of blood and you've not spread it too much. You took one drop of blood and just spread it to a circle. You know, many people ask me, how thick does it have to be? It has to be so thick, like for example, if you keep it on a paper, if you keep this slide on some paper, you should be able to read the text behind it, just be able to read it. So neither very transparent nor opaque. That is how we say, you just keep a newspaper behind it, you should be able to read the alphabets little bit. That's it. That is the thick smear. And then thin smear is how you make your smears in your practical. You take one drop of blood and you make a tongue-shaped smear. When you make a tongue-shaped smear, that is a thin smear. So first you will ask me, what is the reason for making two smears, one thick, one thin? So remember, thick smear is only done because you want to quantify the malaria. 100 parasites are there, 500 parasites are there, 2000 parasites, you want to quantify. But in thin smear, because everything is so thin, you will be able to do the species identification. You will be able to tell me, oh, is it vivax or is it falciparum or what is it? So remember, thick smear is done only to count, acha, haan, malaria 1, 2, 3, 4, 5. But thin smear is to tell you, oh, this is vivax or falciparum. And what is the, you are saying, ma'am, I'm a pathologist or a microbiologist. Both, anyone with a microscope is basically entitled to do this. So pathologist, microbiologist, dono karte. How many, fields will I look? I can't keep looking at this slide all day long. Kab tak dekhna hai? So I will say, if you find malaria, then to just report it as malaria, stop looking at it. If you don't fight malaria, if you're planning to give the patient negative for malaria, you should have examined at least 200 to 300 oil immersion fields. Oil immersion fields means you are going to identify this in oil. Oil ka kya magnification hota hai in microbio? I have told you the 100x magnification. So remember, to 100, 200, 300. 100 wale field mein, matlab oil immersion field में 200 or 300 fields you should have seen. Then you say, अच्छा अभी भी नहीं दिखा तो मतलब it is negative. But is this the best test in terms of sensitivity? Not really. देखो thick smear के लिए, because you're taking more amount of blood, your sensitivity is still good. It is 5 parasites per microliter. Also, if you have in the blood, you will see it. For thin smear, because the amount of blood is very less, it's very thin and spread out, you should have at least 200 parasites per microliter of blood to be able to see it. So thick smear has a better sensitivity, 5. Thin smear has 200. So now you will say that, okay, slides are ready, ma'am. What is the stain that you're going to put? So we always in hematology, na, hemat ka problem ho gaya, ye blood problem hai, to Romanovsky stain. And let's see how many of you have read pathology from me from hematology section. Tell me the Romanovsky stains, all the family members. There is something called the Giemsa stain. Then there is something referred to as the Leishman stain. Then there is the Wright stain. Then there is the Jenner stain. All this I have taught you in pathology. And there is a field stain, out of which, let me tell you, F for F ka mnemonic tha. Field stain is an important stain for which plasmodium? For falciparum. You can use any of these, but as per the national malaria program of our country, what we have to use is the Jaswant Singh and Bhattacharya stain. Jaswant Singh Bhattacharya stain is what we are going to use. JSB staining is what is preferred for malaria. That is as per our malaria programs. Okay, so your staining has also been done. Now, before I move forward and show you all those pictures, I just want all of you to know that these are the 4 families. So before we begin, we should be knowing that, look at these 4 species: Vivax, Falciparum, Malariae and Ovale. Under these, you should be knowing that, please note, Vivax and Ovale definitely have one kind of group. Na? So Vivax and Ovale may, if I ask you which set of red blood cells will it affect, it is going to be affecting the young RBCs. Vivax and Ovale are going to affect the young RBCs, and those RBCs are going to become enlarged. So they are going to become large. So you can learn it as whatever mnemonic you can make out of it. But if you just have to learn one of these so that the others can become opposite. Anyway, Vivax and Ovale are going to involve the young RBCs, and it is going to be the large RBCs. However, all the others show you normal RBCs. And all the others like falciparum में all आता है ना, तो it will affect all ages, young ages also, old ages also. Malaria is an old man matlab it is going to be old RBCs only. So like I said, if you've learned one, then you've learned all the others. So simple, Vivax and Ovale में they are going to be young RBCs, and the young RBCs are going to become very, very large. So they are enlarged RBCs. Also, another thing on which you don't get a picture, but you get theory questions. What are the dots and clefts that you see? Iske liye we have a mnemonic. You see these microscopically, but you won't get a picture on these. Remember, Vivax shows you Schaffner's dots. These are all microscopic features. Falciparum shows you Morer's clefts. Malariae shows you Zeeman dots, and Ovale shows you James dots. How am I going to learn it? Please remember, Viva exam mein examiner is always going to keep shuffled questions. Viva exam mein examiner won't ask you chapter wise questions. So Viva exam mein everything is going to be shuffled, right? So Schaffner dot dikhega. When you write falciparum, can you read it opposite? If you read it opposite, it is sounding like MAUR. So it is going to show you Morer's clefts. Next, when you say Plasmodium malariae, you're going to see man dots. So malaria mein dikhega Z man dots. That is how I have learnt it. Malariae is going to show you the presence of Z man dots. Okay? And finally, ovale. How many alphabets? 1, 2, 3, 4, 5. Which dots? James. 1, 2, 3, 4, 5. Although they are saying vivax and ovale, sab kuch same tha, to Schaffner bhi same kar do. You can see that. But yeah, till now the textbooks mention ovale shows you 5 alphabets, James shows you 5 alphabets. Ho gaya, now it's simple. Viva mein shuffle the questions. Then you have falciparum, to MAUR, Morer's clefts, malaria, man dots, and ovale is going to be James. Out of them, which of them are the young RBCs? So vivax and ovale mein, remember young RBCs and large RBCs. Okay, this is done. Now finally I can take you to all the pictures one by one that I will show you. But what is going to be common to all vivax, falciparum, ovale and malaria is that we have malarial pigment. Malarial pigment kya hai? That whenever malaria comes into our body, hemoglobin is changed into hemozoin. So if you look very carefully into this cell, you will be able to see a brown color dot over here, and this brown color dot is nothing but this brown color dot is the hemozoin or the yellow color pigment. That is a property of almost of all malaria species. Yellow ka color varies, but property is seen by all. Hemozoin pigment is gonna seen by all in the malaria. Now let's start one by one. So rather than showing it to you like this, I will start first with Plasmodium vivax, and for everything you have to know TSG. What is TSG? So the first form that you have, please remember, the first form that you have in Plasmodium vivax, the T is going to be trophozoite. And in simple words, if you want me to tell you, trophozoite is going to be the ring form. So how many rings do you see over here? I see one ring, and in that one ring I see one dot. So that is how I've learned it. Dekho, vivax is having that V wala sound. So vivax is everything 1 1. Vivax 1 1. One ring, one dot, and as you see over here, yes, of course, there is one ring and there is one chromatin dot. That is what? That is an early trophozoite. This is early trophozoite. As it becomes late, can you see? Abhi bhi there is one ring and one dot, but that ring has become a little mota. That ring has become a little mota, so this ring form is known as amoeboid form. This is now referred to as the amoeboid form. Do you want to see actual pictures? Have a look at this. Look at this, guys. The first picture over here. How many rings? One ring, one dot. This must be the early trophozoite. This is the early trophozoite because I am seeing the beautiful one ring, one dot. But after some time, it starts looking like this. It is still a ring. It is still one ring, one dot, but that ring has become so mota. That ring has become so mota. So this must be a late trophozoite. And when I say late trophozoite, that has got a very weird shape, and that is known as the amoeboid shape. So everyone's okay with the trophozoites? Yes, repeat them once again. The early as well as the late are done. Early ho gaya, late ho gaya. Let's come back. After T, we had the S. So TSG karna tha na. This means now what I have next are the schizons. Schizons kuch nahi hoga. Early ho, late ho, you will see dot 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 inside it. What are those dot dot dot? Dot 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 are nothing but merozoites. Remember, schizon was that water balloon. Every time it bursts, person has fever. So this is what a schizon looks like. Dekho, uske andar dot 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 hai. That dot 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 are merozoites. So these are the schizoids that are present. Done. Now coming to TSG. The G stands for gametocytes. So first and foremost, you have to know there is a male and there is a female. Which is macro, which is micro. Remember, the micro word will always be used for whom? It will always be used for males. Males are going to be microgametocytes, whereas females are gonna be macrogametocytes. Dekho, female ko zyada importance. You have to give more importance to females. So females are always called as macrogametocytes. Males are called as microgametocytes. Can you see the structure? Both of them are looking round. So vivax, remember vivax, like you were doing one ring, one dot. Vivax is going to be oval gametocytes. They are spherical, or you can, in simple words, from now onwards, you can refer to it as oval gametocytes, whether it is male, whether it is female, oval or spherical. How do I know male or female? If the chromatin is in the center, that is going to be male. And if the chromatin is at the eccentric, then it is female. So please remember, if there is a central chromatin, it is going to be a male gametocyte. And if it is eccentric chromatin, it is going to be a फीमेल गेमेटोसाइट. Let's have a look at some pictures. Firstly, oval है, oval मतलब vivax का गेमेटोसाइट है. And after that, if I see, look at this. Tell me, over here the red color chromatin is eccentric. मैम ये तो females का था. Females मतलब give them importance. Macrogametocyte is going to be towards the side. On the other hand, the red color chromatin is in the center. Center मतलब it was in males. Males are known as microgametocytes, right? So please remember this. This is how the entire Plasmodium vivax story looks like. This is vivax story, right? So you see one ring, one dot that can become amoeboid form. Then there are schizonts. Then there are oval gametocytes. Now we move on to the next one, and that is Plasmodium falciparum. Does this also have the same trophozoid, schizont and gametocyte? Yes. But please remember, this was also causing something known as cerebral malaria. Now, when this is causing cerebral malaria, it means some things are going to stick inside the brain vasculature. So remember, schizonts are going to stick in the brain vasculature. Schizonts will only be present in the cerebral blood vessels. They will not come out into your usual blood vessels over here. So will you see this in the blood? No. Remember, schizonts are not seen in blood samples. Good for us. Good for us, not for the patient. Good for us because I don't have to know the photo. Means for Plasmodium falciparum, I just have to know the photo for trophozoite and gametocyte, and that's about it because schizont doesn't come out in the blood. So how does the trophozoite look like? So vivax ka ulta karo. Vivax was one ring, one dot, isn't it? So what is this trophozoite going to be over here? There are multiple rings. There are going to be multiple rings, and there are going to be multiple dots. There are multiple rings and multiple dots that are noted. You can zoom in and see. See, you're seeing two rings. Two rings and they're having two dots. Some people start making their imagination run wild. They say, this is looking like headphones. This is looking like earphones. Yeah, you can use any of your favorite things that you want. This is definitely there. But imagine there are so many of them. For example, if too many relatives come into your house, there's some family function, these rings are your relatives, too many relatives come. There will always be that one angry uncle relative of yours who will mind some minor thing that I wasn't asked for a glass of water and will go and sit in one corner. Na? So most of you must have thought of that angry Fufaji's meme that always comes. Same way, when there are too many rings over here, one ring says, "Arey jaga nahi hai, I am going and sitting in the corner." That ring decides that I'm going to go and sit over here. It has gone and got stuck on the margin. So what is that known as? That is referred to as the acole or the applique form. That is referred to as the acole or the applique form. That basically means that there is margination of the ring. The ring decides that I'm going to go and sit in one corner. Okay, margination of the ring is going to be there. So remember, there are lots of rings when there are lots of dots, and apart from that, some dots got angry like a relative and went inside in the corner. So do you want to actually see the same thing that I've taught you? Look at this. Are you seeing like multiple rings in every RBC? Of course, lots, 2-3 of them. And are you also seeing multiple dots? Can you see like two dots everywhere? Yes. But can you see one ring is sitting at the corner? This must be that acole or applique form that I'm talking about. Acole or applique form is what we are seeing over here, that marginated angry relative. So trophozoites to ho gaya. Schizont to happy news. Dekhna hi nahi hai. Now we come to gametocyte. Again, the story is the same. The microgametocyte will be given to the male and the macro word will be given to the female because females ko zyada importance. And what is the shape that you're seeing over here? The shape that I'm seeing over here is banana. Banana shaped gametocytes, male and female ka banana shaped gametocyte is seen. How do I differentiate? Look at this. Females are usually thinner and males are usually broad. Hai na? So remember, the males are going to have broad ends. Sabse pehle the males are going to have broad ends and the females are going to have a little pointed ends. This is the common sense. But in the exam, ma'am, I will never be able to differentiate broad and pointed. Kuch aur batao. Look at the chromatin. The chromatin is all spread out. That's a male. If the chromatin is well organized, it's a female. Think of the girls' hostel ka room versus boys' hostel ka room. Girls are usually more organized. They like to keep their stuff in one place. So if the chromatin is organized, it is highly likely to be a female gametocyte. But if boys' hostel ka room dekho, everything is here and there. So this is how all the things are spread. That is, if the chromatin is spread out, If the chromatin is spread out, matlab ye male gametocyte hai. Although honestly this is a very cliche kind of an example that I give you, because you come to any girls hostel room also, it's always a mess. Every hostel room is a mess, but because for our mnemonic I had to make this. So females ka room well organized, chromatin well organized, males ka room all messy and all everywhere, so chromatin is spread out. Let's see the same thing under a picture. Look at this guys, I can kind of assume ye pointed hai to ye female hoga, or ye aisa round hai to ye male hoga, but this won't help me in the paper. The chromatin will help. See, if the chromatin is all out, it's a male. If the chromatin is all in the center, organized in the center, so these three over here actually which are organized must be a female. Whereas these three that I'm seeing over here, these three which are all spread out, this must be a male. And if you see in the same picture, I can see the trophozoites also. Mujhe wo double ring and double trophozoid rings are also seen. So this is a beautiful picture that we have. So falciparum is done, vivax is done. Now we come to malaria and ovale. Story unme bhi wahi chalega. There is going to be trophozoid, there is going to be schizon, there is going to be gametocyte. The only difference I want you to know it is that in malaria, look what I'm saying, in Plasmodium malaria, there is, instead of a ring कैसा होता है, ring ऐसा होता है. Instead of a ring, it's a पिचकावा ring. The ring gets squeezed. So instead of looking like a ring like this, the ring is looking like a band. So remember, Plasmodium malariae is going to show you the presence of a band form. That is something which is important over here. Rest everything is wahi TSG story that is going on. I hope everyone's okay. This brings you down to the 4. Vivax, falciparum, malariae, ovale, all of them show you hemazoin pigment. And coming all the way back, I had told you in the lab diagnosis, the first thing that I will be talking about is the light microscopy. I am the gold standard. Okay. Now, if you want to do some other fancy wala microscope, that is known as the fluorescent microscopy. So please note that for fluorescent microscopy, we have in a way, please note, fluorescent is something which is said to be one of the screening modalities. And when I say screening modalities, it is it's a very rapid screening modality. It's a very, very rapid screening modality that we have. In fact, although, let me tell you, fluorescent microscope is not something that everyone can afford. It's very, very expensive. But definitely, it is something which is coming across as very, very important for us in the exam. So, it's a rapid screening modality, but it's very, very expensive. This is known as the Kawamoto technique. I wouldn't elaborate much on this because way back in your general microbiology, I told you what is the fluorescent dye that we use for malaria, and that is going to be acridin orange. So the 3 questions that you can get in this is going to be, what is the other name for the fluorescent dye that we are using for malaria? It is Kawamoto technique. What is the dye that we use? Question 2, acridin orange. And this is the screening method of choice. It's a very rapid screening method. Now let's move on to the next one. There is something known as the microhematocrit or the QBC. Microhematocrit or QBC, pehle to you will all have to know the full form. So QBC refers to quantitative buffy coat. These are the pictures that you're going to get. QBC refers to quantitative buffy coat analysis. So first you need to know what is a buffy coat. Quantitative, so you've understood, I'll be able to count, but what is the buffy coat thing? So whenever you take blood and you spin it, if you basically make it undergo centrifugation, you know what you're going to get? You're going to get all the red blood cells over here at the bottom. You will get all the plasma wala part at the top, but where did all the WBCs and the platelets go? There is a tiny little zone in the center, and that is going to be known as the buffy coat. So please remember, there is going to be the plasma and the red blood cells and the buffy coat that is going to be there. So now I am interested in buffy coat because all the organisms are going to come over here. Remember, malaria settles in the buffy coat, and even later on in the last chapter when you study filaria, that also settles in the buffy coat. So you will say that, ma'am, I don't have to look at the entire blood. If I'm wanting to look for malaria, I will just look at this buffy coat. Exactly. So quantitative buffy coat means that, why did I call it microhematocrit? The other name for it is microhematocrit, because I will take a patla sa tube. Remember that tube in which you used to do bleeding time, clotting time in your physiology practical, that patla tube. You take one finger prick, fill that tube, you spin that tube. In this machine, in this QBC test, you have a machine, wo patla tube iske andar you will keep, you will spin the tube, you will get the buffy coat, and you will say that, theek hai ma'am, spin bhi kar liya, buffy coat bhi mil gaya, here I have the buffy coat in front of me. Now what? How should I look at the malaria? If I have to look at malaria, I'll have to look at it under the microscope. But how? Have you added any dye? Now I'll reveal something. You know, in this tube, from beforehand, you have a dye that is present. From beforehand, the company has added a dye, a fluorescent dye. And what is that dye? What did I say? A company has added a fluorescent dye. This means this was already coated with acrid in orange. This I was not aware. When the company gave me this tube, it was already coated with acrid in orange. So now when I look at this tube, I'll place this tube under the microscope. I'm not going to see the entire tube. I'm only going to see this buffy coat area. I will start seeing the malaria shine out like this. Whatever malaria is there, trophozoite, gametocyte, jo bhi hoga, all of that is going to shine out like this. So that is the QBC test, because it is going to use the quantitative buffy coat method. Please remember, the sensitivity is equal to 2 parasites per microliter of blood. It is 2 parasites per microliter of blood. So it is really sensitive, but the problem is that it is sounding only such an expensive machine. You need that tube, then you need that centrifugation wala machine, then you need that fluorescent dye, too many things needed. This is very complicated. So of course, अच्छा है, but it is definitely going to be a little complicated. So this is also done. अब आगे क्या चले, क्या क्या हो गया? Light microscopy done, fluorescent Kawamoto done, microhematocrit and QBC done. PCR, of course, will be the most sensitive if you can afford to do that for malaria. But what we are actually doing for malaria in most of the cases is RDT. What is RDT? RDT stands for, after COVID, you guys are very, very well versed with what is RDT. It is a rapid diagnostic test, or in other words, it is going to be a card test. In other words, it's going to be a card test. So be it any card test on this planet, or hepatitis B, C, HIV, typhoid wala card test, या COVID wala card test, या urine pregnancy card test, or any other card test like malaria, the principle is gonna be the same, and that is immunochromatography, ICT. Immunochromatographic testing is the principle for it. And what is the sensitivity? 50 to 100 parasites per microliter is the sensitivity out here. So this is what a card looks like. Let me tell you, ICT, immunochromatographic testing, is the principle. And can you see a membrane inside it? This has something known as a nitrocellulose membrane. This has a nitrocellulose membrane inside it. And I can see one hole over here is going to be for the buffer, and one square over here is where we are going to add our blood sample. So this is going to be for the blood sample. So buffer and blood sample will mix. Control line though has to be there, because control line is going to tell me the validity of the test. Control line matlab everything is fine, my buffer is fine, blood is fine, everything is fine. Control though has to be there. The test line is going to tell me whether there is malaria or no malaria. So I'm going to actually show you a lot of these tests. You have malaria written on every card, but kya kya dikha hai? Control, you'll say control line तो मैम ठीक है, I have understood. Control line तो has to be seen. तो यहाँ दिखा, मतलब it's a valid test. Control line यहाँ पे है, valid test. Control line है, valid test. यहाँ control line is not there. Don't read it. Throw this card away. Ask for a fresh card, fresh sample. This is a wrong test. Something wrong has happened. Either the blood was clotted or this kit is expired. कुछ तो गलत हुआ है. Just don't read it. So control line has to be there. That's a validity. Then you will start seeing whether it is pan malaria or only falciparum. You will say, why this discrimination, ma'am? All the malaria you have kept under one, and falciparum alag se rakha hai, because falciparum causes cerebral malaria, right? So you need to know the urgency of it. But how is this working? Remember, all the malaria species, listen to me very carefully, all the malaria species have AL for aldolase. They have aldolase in them, and the remaining L for LDH. So what is the principle? All the malaria species have what antigens? They have AL for aldolase and L for LDH. So ye to yaad ho gaya, all of them are gonna have this. But only Plasmodium falciparum has histidine-rich protein 2. This is a recent exam question. Only Plasmodium falciparum has a histidine-rich protein 2, which is very, very important for you to know. So this means that I can pick up Plasmodium falciparum. This means that Plasmodium falciparum has this also. When I said all malaria species have aldolase and LDH, means malaria, vivax, ovale, falciparum, malaria, everyone has it. So even falciparum has these two also. Something extra falciparum has. Falciparum, apart from aldolase and LDH, it is also going to have histidine-rich protein too. So now tell me, if you don't get any line, देखो control का line तो आया था तो valid है, but यहाँ पर there is no line. So what is your answer, ma'am? This must be negative for malaria. Here you get a control line, valid है, and you get a line in pan malaria. Pan, but not in falciparum. You'll say, ma'am, कोई भी हो सकता है. It can be Plasmodium vivax, Plasmodium ovale, Plasmodium malariae. But one thing is certain that Plasmodium falciparum नहीं है, because falciparum में line नहीं आया. When I came to this one, I got a line in pan also. I got a line in falciparum also. So this is to certain के falciparum है. See, falciparum has HRP2, that is why it gave a line here. Falciparum also has aldolase and LDH, so it could give a line over here also. So falciparum to hai, but what if this was a case of a mixed infection? What if this was a case of, say, vivax plus falciparum? Just example. So vivax would have given a line over here, and falciparum will give a line in both places. So two situations, either it is a mixed infection or it is only falciparum. That is when you get a triple line. So if you get a triple line, either it is falciparum or it is falciparum with something. And this means you don't know the final answer. That is why I'm coming back to the point that I am really important. Gold standard is me. I am gold standard. Light microscopy, right? That is why, because cards are not going to be that reliable. And that is your RDT, Rapid Diagnostic Card Test. Principle, immunochromatography, membrane, nitrocellulose membrane. All the malaria have aldolase and LDH. Plasmodium falciparum has histidine-rich protein too. Malaria, sigh of relief, is done for us. What are we going to move on to next? Let's give you a spotter. What is this? Again, you'll say, ma'am, rings ही तो दिख रहा है. ये तो Plasmodium falciparum and vivax जैसा rings है, but those rings are making a tetrad. Over here, the rings are making a tetrad. So there are a tetrad of rings formed like a cross. 4 rings are making a cross. That is known as Maltese cross appearance seen in Babesia. And that is what I'm going to start with next. Babesia, like malaria, is also something in the red blood cells, but इसमें malaria वाला pigment नहीं होगा. Life cycle is different and no pigment is there. So what is the host? Definitive host is actually going to be a heart exuded tick. An intermediate host is going to be some mammal like rodent or cattle or all of those, right? So we are to bilkul end mein. Babesia mein we are like the accidental hosts. So basically, malaria mein, what were we in malaria? Definitive or intermediate? Malaria mein main to female Anopheles mosquito tha. Malaria mein humans were what? We were intermediate hosts for a change, right? But in Babesia, we are not even that. Babesia mein to hum bilkul hi barbad hain. We are accidental hosts. We have been thrown to one corner. Matlab good for us, but we have been thrown to one corner. How many types of Babesia do you have? Babesia microti, Babesia divergens. How will you learn it? My Babesia microti. Alag alag kar lo. Roti will remind you of ratty. Ratty means the host is going to be rodent. And my will remind you of mild. It is a mild disease. Ho gaya yaar? Remember, microti tells me micrati. From today onwards, call it Babesia micrati because it's going to occur in the rat. And the mild infection will be there, whereas Babesia divergens alag ho gaya. It's going to be cattle and it's going to be a very severe infection. And please remember, why is it so severe? Because in these patients, usually this happens because the spleen has been removed. Whereas why is Babesia microti or micrati very normal, or why is it milder? Because spleen is there to fight for you. So if the spleen is there to fight for you, disease mild hoga. When the spleen is only not there to fight for you, then the disease is going to diverge out in many spectrums and result in the severe infection. Be it whatever case, remember the question that comes is, what is the way of spreading? Hard exuded tick. And what do you get under the microscope? You see a tetrad of rings, Maltese cross appearance. Is that okay with everyone? So clinically क्या होगा patient को? There is a typical something like I told you ना, malaria का भाई है, fever with chills and sweating, same वाला चीज. The treatment is going to be as if AA. The treatment is going to be azithromycin with etovaquone. That is going to be the treatment. However, if it is very, very severe, and when do I say it is very, very severe? When more than 10% parasitemia is there. In that case, I will give IV clindamycin with quinones. So quinines are going to be given. Quinines and clindamycin will be given in more than 10% parasitemia. But that is going to be the end. But before I end, one question I want to tell for all the INI CET aspirants, that this Maltese cross appearance that you just discussed, where else do you see it in path and micro? एक तो अभी Babesia में देखा, right? But other than that, where do you see it? One more place in micro. Cryptococcus का CSF also shows you this. And where do you see it in pathology? If you see the urine of a Fabry disease patient, Fabry disease के patient के urine में बहुत lipid होता है. Any lipidaceous urine, like for example nephrotic syndrome के patient में lipid होता है, any lipidy वाला urine is going to show you this Maltese cross appearance. And if you want to know that glove powder, if you ever look at it under the microscope, na, that also looks like Maltese cross. So these two are primarily important. Fabry's is very important for pathology because any lipid thing will show you Maltese cross, and micro में Babesia is the most important. And yes, we are ready for some MCQs. I hope the first one you read very carefully and are not in a hurry. 22-year-old male patient presents with fever and chills and blood counts show hemoglobin OK12, TLC 13,000, DLC में क्या है? Neutrophils are 50, lymphocytes are 29, monocytes are 20. I hope you remember from your general pathology again. I had taught you way back in the other subject, in patho I had taught you कि monocyte बढ़ता है, malaria में monocyte increases. Peripheral smear shows the presence of RBCs and presence of applique forms. As soon as I say applique forms, acole forms, I am talking about Plasmodium falciparum. However, few of the RBCs are showing the presence of band forms. If they are mentioning band form, it is going to be Plasmodium malariae. There is a student of mine who made a mnemonic called Mala band. Mala band matlab ye jo Plasmodium malaria hai, that is going to show you band forms in case you had forgotten. Mala band is what you will learn. So guys, dono dikh raha hai, matlab this was a case of a mixed infection. Don't be in a hurry. Many students read applique and marked falciparum. Many students read band and marked Mala band, but this is both. So this is a mixed infection. Let's move on to the next one. What is your diagnosis? There is a triple line that you see. Is it for falciparum, vivax, for non-falciparum, mixed infection, or A and D? So you will say, ma'am, triple line में हमने कहा था या तो pure falciparum है, option 1, या फिर it is falciparum plus something, so mixed infection. So basically both these possibilities I will have to keep. So option E is the best answer. Next question. Which of the following is incorrect about antibody detection for the diagnosis of Plasmodium falciparum? Is it based on the principle of immunochromatography? Yes. CART test, correct. Does it detect the aldolase antigen, aldolase, LDH? Yes, all malarias have aldolase and LDH. Does it have HRP antigen? Of course, Plasmodium falciparum has na, but this is wrong statement. Why? Because it has histidine-rich protein 2. What a way of catching you. Very, very sadistic examiner. And so this is histidine-rich protein 2 which Plasmodium falciparum has. So that becomes the wrong answer over here. So we are done with the sporozoa. I hope you guys have benefited from it.